topic today. And most of all, I want to thank all of you attendees for taking some interest in this important topic. As was mentioned, this week is actually World Thrombosis Day on Sunday. So we have a holiday for everything now. And in particular, there's a lot of awareness events happening this week around thrombosis, including what to look for in the signs and symptoms. So again, I commend all of you for spending the next half an hour or so on this topic with me, and I'm more than happy to answer any questions you have at the end of the presentation. Don't be shy. This is your time to have your questions answered. So, as was mentioned, the topic for today is what to know about clots in cancer, and we'll spend the next half an hour talking about this together. So, a little bit about me. This is where I work. I work at St. Michael's Hospital in downtown Toronto. I'm a hematologist, but I also work in our thrombosis clinic, and I work very closely with a number of medical oncologists at our center. And so this topic is very near and dear to my heart. It's part of what we see every day in practice. We have 4 simple goals for today. The first question is, what is a blood clot? We use the term blood clot, but what actually is a blood clot, and why is it important to your health as a patient? Secondly, when should you worry? What signs and symptoms should you look for that would suggest the presence of a blood clot either in the legs, the lungs, or in the arms? Thirdly, what should I do if I'm worried? Who should I speak to? Who should I call? And how urgently should I do it? And finally, at the end, we will talk about how blood clots are treated, the different types of treatment that are available, a little bit about how effective they are, and how long to treat you for. So, as you know, cancer and blood clots often come together. And I'll mention throughout the session that I will often use the term thrombosis and clots interchangeably. Thrombosis is the medical term for blood clots. So cancer and clots often come together. And in fact, if we look back at studies, about 1 in 200 patients, or about 0.5% of patients with cancer, will develop a blood clot every year. If we follow people out for longer, depending on the study that you look at, about 4 to 20% of patients with cancer will experience thrombosis at some point. And what that could be: a clot in the legs, a clot in the lungs, a clot in the arms. This extends throughout the treatment period for cancer. Moreover, we know that blood clots in general are very common across North America, but up to 20% of blood clots that happen in the veins in North America actually occur due to cancer or its associated treatment. But not everyone is the same. And as you know, every patient and every person is different. Everything that you're going through is different than what someone else is going through sitting right beside you. And so there are some things that can increase your risk of developing a blood clot. For example, if you're receiving chemotherapy or hormone therapy, depending on the type of chemotherapy you're receiving and the type of hormones, that can increase the risk of thrombosis. Radiation therapy. So at the beginning of treatment, often radiation is combined with other types of therapy for cancer, and the radiation itself, while having obvious benefits for anti-cancer treatment, can also increase the risk of thrombosis as well. And then surgery. So as you all know, surgery is an important part of the treatment for cancer, and many aspects of surgery can increase the risk of thrombosis as well. That would include hospitalization, inflammation from the surgery, if there's any issues with the blood vessels that are around where the surgery happened. And so this can also increase the risk of thrombosis. Now, while all these treatments can increase the likelihood of developing blood clots, it goes without saying that the benefit of these treatments certainly outweighs the risk, and these are often much needed medically necessary therapies for cancer. But we know that they do increase the risk of thrombosis as well. Other risk factors that might increase the risk of developing blood clots would be the following. If you're admitted to hospital for some reason, being immobile in bed, not moving around, having an illness, the inflammation from that illness and from being in hospital can also increase the risk of blood clotting. And for that reason, often when people are admitted to hospital, we strongly advocate for the use of preventative low doses of blood thinners in hospital, but even with that, sometimes blood clots can happen. Infection. So infections can often lead to hospitalization, but even outside the hospital, being immobile from a serious infection can also increase the risk of clotting as well. And also the disease itself. So if the disease is growing, or if it is spread to other parts of the body, then we know that this also can increase the risk of thrombosis compared to other types of disease that maybe are not spreading to distant parts of the body. We should also keep in mind that often patients receive medications through intravenous lines or central lines, like PICC lines that are inserted through the arm. So in this cartoon, this person's right arm has a PICC line right in the elbow area, and you can see that that PICC line is a foreign body that goes right into the vein, the deep vein, the superficial veins, which lead to the deep veins of the arm. And sometimes the presence of a foreign body can also increase the risk of clotting, because after all, a vein usually doesn't have a foreign body or a foreign material in it, and so sometimes the body can react by having the development of a blood clot there. Of course, these are medically necessary for both chemotherapy and for blood work, but they can also increase the risk of clotting. Also, if you have a catheter in your neck, like a Hickman line, for example, this can also increase the risk of clotting. So in this example, if you feel your own neck on the right side, there's a vein called the jugular vein there, and it runs down just below the collarbone. And often we insert catheters in that area as well, again for the administration of chemotherapy, fluids, or for blood work. And the presence of a foreign body there can also increase the risk of clotting as well. And that's important to know, because the signs and symptoms of a blood clot resulting from a PICC line or a central catheter would be different. We'll go over those signs and symptoms in a moment. Something else that I will mention is that the risk of a dangerous blood clot is greatest in the first few months after a cancer diagnosis. And the reason is likely because this is around the time when treatments occur. This is the time when people receive chemotherapy, radiation, and surgery, and this is often the time when we see blood clots developing within the first 3 to 6 months of a cancer diagnosis. So let's talk about that first point. What is a blood clot? So this is a diagram of a person, and you can see in the right, we're looking at it from behind, and you can see in the right leg there is a blue vein. And these are the deep veins of the leg. So you can't actually see them on your own leg, but if you were to take a cross-section of your leg, there would be a deep vein running right through the middle. And this arrow is pointing to the knee, and you can see that the deep vein runs right through the thigh, down past the knee, into the calf. So blood usually flows normally. So this is a diagram of little red blood cells floating upwards back towards the heart. And you can see that they're not sticking together, they're flowing quite nicely through the vein and returning back to the heart. When a blood clot happens, however, this is on the right-hand side, these blood cells start coagulating together, they stick together. And you can see instead of flowing in an orderly fashion, they can start sticking to the side of the blood vessel. And over time, if enough of them actually stick together, they can actually occlude the blood vessel and prevent blood flow from going back upwards towards the heart. You can see at the top there of the purple box that there's a detached blood clot there as well. So sometimes when blood clots happen, parts of them can actually break off from the legs and travel to the lungs. So when a blood clot happens in the deep veins of your leg, that is called a deep vein thrombosis, or DVT. And when the blood clot breaks off and goes to your lungs, that's called a pulmonary embolism, or PE. The same process can happen in the arms, as we mentioned, in patients who have catheters in place, and you can imagine that you could see blood clotting in this fashion as well in the arms. So what happens in the leg when the blood's not flowing properly? Well, imagine that you're on the highway and you've got lots of cars and they're stuck for some reason. Let's say there's a car accident, for example. What will happen over time is that the cars stop moving and eventually they start leaking out onto the side streets. And as a result, you see lots of backup of cars. And the same thing can happen in a leg. So as I mentioned before, the blood should be flowing back up from the leg up to the heart. But if the blood's not flowing upwards properly, then what happens over time is that fluid from the blood actually seeps into the tissues of the leg. And what we see is the leg becomes swollen, especially around the calf area. And this could happen in the thigh as well, but often it's the calf where we notice these symptoms. So it can become quite swollen, and sometimes we also see that it becomes quite red as well because of the backflow of blood. And so these are the typical signs and symptoms of a deep vein thrombosis. And if you compare the leg that looks quite swollen here to the leg beside it, you can see that there's quite clearly an asymmetry between the two legs. So in summary, this is what to look for in terms of signs and symptoms of a deep vein thrombosis. So if you see swelling in the foot, ankle, or leg, particularly if it's on one side and not the other, that might be something to think about. If there's pain or tenderness that's often starting in the calf, that may be a sign of a DVT as well. If it's red or there's noticeable discoloration, or if there's warmth on the leg or the affected area, that may be signs of a DVT as well. This is a diagram from worldthrombosisday.org, and if you go to that website after this presentation, there's lots of good resources about deep vein thrombosis on that website. What about pulmonary embolism? So pulmonary embolism, as I mentioned, is when a blood clot breaks off from the legs and travels to the veins in the lungs. So they start in the legs as a deep vein thrombosis, and then they travel to the veins in the lungs, which are also called pulmonary arteries. So this is a diagram of the lungs, and you can see right in the middle of the two lungs is the heart. So you can see the little blue structures within this diagram. And as you can see here, there's a white arrow going through the heart here, and this is the blood flow. And you can see if you follow the white arrow towards the smaller blood vessels, which are the veins in the lungs, you can see little bits of clot that are getting stuck here in the little branches. It looks kind of like a tree. And this is what happens. When a blood clot from the lungs goes through the heart into the veins in the lungs, it can get trapped there and cause a pulmonary embolism. And the symptoms and signs that people typically experience would be chest pain or shortness of breath, relating to the inflammation from the blood clot in that area. Because after all, you are affecting the blood flow to parts of the lung, and you can have symptoms like chest pain or shortness of breath. Now do keep in mind that there are bigger blood vessels that are closer to the center of the heart, and if you have a large enough blood clot that impacts on the blood flow leaving from the heart here, that can actually lead to symptoms of lightheadedness or dizziness. And this can happen because the blood flow that is going through your heart can actually become reduced or impaired, and as a result, you may feel lightheaded. In some instances, people actually present with fainting as a sign of a pulmonary embolism as well. But of course, there are many other reasons why people faint as well. So in summary, what to look for in terms of signs of a pulmonary embolism, or PE. If you have unexplained shortness of breath or rapid breathing, if you have chest pain, those could be signs of a PE. A rapid heart rate may occur as the heart is beating more quickly in response to the blood clot. And finally, as we mentioned, if you feel lightheaded or faint, that could also be the signs of a pulmonary embolism as well. What people often notice, however, is that these symptoms don't happen very quickly. They can happen gradually. So you may experience that you're feeling quite winded and that you're having difficulty doing things like walking upstairs or doing household chores, and you may have reduced exercise capacity. There's many reasons for why this can happen, and certainly people who are receiving treatment for cancer often have many other reasons for why they may feel tired or fatigued. However, these are symptoms that you should tell your doctor about because they can sometimes signal the presence of a pulmonary embolism as well. And the second question is, what about these chest symptoms? What is worrisome and what is not worrisome? Well, the challenge is that everyone experiences pulmonary embolism different, and this is true both in people who have cancer and people who don't have cancer. But the things that make me worry would be if the pain is sharp, or if you take a deep breath in. So if you take a deep breath in right now, sometimes people complain that when they take a deep breath, they feel a sharp pain, often around the rib cage. And if that happens, that could be a sign of a pulmonary embolism as well. If you're experiencing chest tightness or chest pressure, that may be signs of a pulmonary embolism as well. Although again, these can be signs and symptoms of other medical conditions as well. Your oncologist may also tell you when you're in his or her clinic that they've done a CT scan of the chest to assess the stage of your cancer or your response to cancer treatment, and they may tell you that they have found a pulmonary embolism incidentally, which means just on routine screening, they accidentally find presence of a blood clot in the veins. And this may occur even if you've not felt any symptoms or noticed any symptoms. These are called incidental blood clots in the lungs, and we usually treat these blood clots just like symptomatic blood clots. So in other words, a blood clot found by accident on screening CT scans, we would typically treat these as blood clots where you've presented with symptoms of a blood clot as well. And the reason is that we worry that the presence of a previous blood clot could indicate an increased risk of having a future blood clot, and so we treat these the same way. What about PICC lines and central lines? What symptoms will they cause if they have associated thrombosis? So this is a picture of a patient and their arms only. And you can imagine if you had a PICC line inserted in the elbow or a line in the neck, that someone, if they've developed blood clotting, may have symptoms of swelling or pain or soreness or redness, just like in the leg. However, these symptoms may be over the shoulder, the bicep, or the forearm. And sometimes this can cause the presence of dilated veins along the chest wall. In other words, the veins along the chest wall may be more prominent than typically due to pressure building up due to the presence of a blood clot. Also note, sometimes when there's a blood clot in association with a PICC line or a central line, this may affect the function of the catheter. So for example, if the catheter is becoming sluggish or not working when blood is being drawn, or if the flows are challenging when people are receiving chemotherapy or fluids, sometimes this can be the signs of a blood clot in association with a line as well. There are other reasons why this can happen. However, if there are signs of a blood clot in addition to the catheter not working properly, that may be the signs of a blood clot as well. So, why do blood clots matter? Well, clearly they can cause symptoms. Chest pain and shortness of breath are certainly not comfortable symptoms to have. And similarly, swelling in the legs and pain in the legs is often quite distressing as well. And so it's important to receive treatment to reduce the discomfort from these symptoms. Furthermore, if these blood clots are not treated, then sometimes they can lead to long-term damage, especially in the veins of the leg, for example, which can lead to swelling in the legs in the long term. Sometimes blood clots can lead to hospitalization. So if there's a rather large blood clot, or if if there are issues receiving the treatment for the blood clot, sometimes people are admitted to hospital for this. And moreover, as I mentioned before, if someone's been admitted to hospital, blood clots can happen as a result of hospitalization as well. Also, quality of life. So blood clots, due to the symptoms they cause, can affect quality of life. And furthermore, we'll talk about the treatment, but the blood thinning medication that people use, especially needles, can also have a significant impact on the quality of life. And also delays in cancer treatment. So the presence of a blood clot may sometimes delay cancer treatment, especially if it's in association with specific types of chemotherapy, and this is something you'd want to discuss with your oncologist as well. Finally, and most importantly, blood clots, especially pulmonary embolism, can be fatal. So venous thromboembolism, or venous thrombosis, is the second leading cause of mortality in cancer after cancer itself. And so timely treatment can be life-saving, and that's why we have events like World Thrombosis Day to increase awareness about the issues around clotting and cancer. So in summary, don't ignore your symptoms. Please do tell your doctor or your nurse. I would implore you to not assume that it's not simply a side effect of chemotherapy or radiation. I think it's tempting to ascribe most of our symptoms to the treatment that we're receiving, but that's not always the case. Don't assume it's the flu. So it's October now, and we are already seeing people coming in with viral illnesses, and it might be the flu, but it may also not be the flu. Don't assume that it's necessarily a pulled muscle. I've seen this several times when people have assumed that it's a pulled muscle when in fact it's been a pulmonary embolism. And finally, even if it's not a pulmonary embolism or DVT, it might be something else important. So for example, chest pain, shortness of breath, even if it's not a pulmonary embolism, could be an issue with the heart, or it could be a signs of infection in the chest. So something important to keep in mind here. So what to do if you're worried? So if you are worried and you're having shortness of breath or chest pain, or if your leg is acutely swollen, you should go to the emergency room. This is an emergency, and as I mentioned, treatment can be life-saving. And so a prompt diagnosis needs to be made, and you should go to the hospital with these symptoms. Alternatively, if you're in your clinic, you should let your doctor know. So you should let him or her know that you've been having these symptoms and discuss them with the doctor, and they can do appropriate testing if necessary. Finally, if you're alone at home and you can't get to the emergency room, you should call 911, because as I mentioned, this can be a medical emergency and this deserves prompt medical attention. Venous thrombosis is an emergency, and I would encourage you to think about acting on the signs and symptoms if you experience them. So let's say you've come into the hospital now with a swollen leg, and the doctor is trying to diagnose a deep vein thrombosis. The way that we do this is with an ultrasound. So anyone who's had a baby will be familiar with an ultrasound. That's when they use sound to look inside the body. And in this case, we are using an ultrasound to look at the veins, the deep veins of the leg. And so the technologist will compress the veins in the leg, looking for the presence of a blood clot in the deep veins. Meanwhile, a pulmonary embolism is diagnosed with a CT scan of the chest. So the way that this is done is you would be lying down in an X-ray machine, and then contrast or dye is used to highlight the veins, and in particular to look for the presence of a blood clot within those veins. And that's how a pulmonary embolism is diagnosed. And why is it important to treat thrombosis? We did talk about this, but certainly the goal is to prevent extension of the blood clot. So for example, if there is a deep vein thrombosis, providing blood thinning medication can prevent that clot from growing and from breaking off and causing a pulmonary embolism. We want to improve the symptoms of pulmonary embolism or DVT. Reducing the inflammation and the progression of symptoms from PE or DVT are important, and patients often experience quite rapid improvement after they've been started on blood thinning medication, although sometimes it can take some time. It really depends on what's happening. We also want to prevent recurrence. So after the first 1 to 3 months, the pulmonary embolism or DVT has been treated. However, because the blood clot happened due to cancer or the treatment of cancer, there is always, or there will be, an ongoing risk for thrombosis. And so after the first few months, the goals of therapy are to prevent a new blood clot from happening. And we will talk more about that at the end of the presentation today. And finally, we want to avoid delays in cancer therapy because we know that the priority is to progress with treatment for the cancer. And so rapid identification and diagnosis of thrombosis can help to avoid delays in cancer treatment. So what is the treatment for blood clots? The treatment is blood thinning medication, which we call anticoagulants. So this is a picture of a deep vein with a blood clot inside. And as we mentioned before, the blood thinners work by preventing the clot from getting bigger or by preventing the clot from breaking off and causing a pulmonary embolism. The body actually breaks the clot down on its own over a period of weeks to months. So the blood thinning medications that we typically give do not bust up the clot. What happens is the body breaks the clot down over a period of weeks to months. And so in most patients, after that period, the clot will be completely broken down, but there are a significant proportion of people who will be left with some scar left over at the end of 3 months of treatment, for example. And that's not a surprising result. That will often happen, but the body usually breaks the clot down at the beginning to prevent it from getting bigger. So let's talk about treatment. So what blood thinning medications do we have available? At the moment, there are 3 main options. The first option, and the option we've been using over the past 15 years at least, has been a drug called heparin, also called low molecular weight heparin. And if you've been admitted to hospital or if you've had a blood clot, you may be familiar with these drugs. These are needles that are administered under the skin once a day, typically once a day, sometimes twice a day. And these needles they come in different brands. So I've listed the 3 most common ones that we use in Canada. There's dalteparin, also known as Fragmin. There's enoxaparin, also called Lovenox, and then tinzaparin, which is also called Inohep. And depending on where you receive your care, there will be different practice patterns in terms of which of these options is used. These drugs are all very similar and they're all similarly effective. In terms of how they're administered, usually my patients will administer this medication to themselves, although sometimes we have home care administer these injections as well at home. These needles come in different formats, and so they have different safety mechanisms. So for example, the Fragmin needle here is actually a spring-loaded mechanism, and after the medication is given, the needle actually enters back into the syringe, and so you won't poke yourself. Whereas with tinzaparin here, there is an orange cap that folds over the needle and actually prevents the sharp end of the needle from contacting you and provides a safety mechanism for this needle. So a bit more about low molecular weight heparin, or heparins. As I said, these are usually administered once daily. They do not interact with most chemotherapy or foods. And the dose is different depending on your weight and your kidney function. And so your doctor will choose the dose that's most appropriate for you. But if you do lose weight, so if you lose up to more than 10% of your body weight, you should let your doctor know, because sometimes the dose may need to be adjusted. And the coverage for this drug varies by province, and it also varies depending on the type of drug coverage you may have. And so these drugs are very commonly used nowadays, and we've been using them very commonly, at least for the past 15 years. This is an example of a patient administering a needle of a blood thinning medication to themselves. If you're familiar with insulin, it's very similar in terms of the size of the needle and what the needle looks like. And you can see that the patient here is pinching the tissues and the fat, and that's right where the needle goes. Let's talk about pills. So we have 2 options for pills. Nowadays, the most common pills that we are using are called direct oral anticoagulants. The other name for this is new oral anticoagulants. So oral just means you take the drug by mouth, and then anticoagulant is the blood thinner. So these oral anticoagulants have been on the market for about 5 or 10 years now. And up until about 2 years ago, we had limited research demonstrating whether they were effective or not. We have two options now that we are using most commonly in our clinic. The first is called edoxaban, also called Lixiana, and the second drug is called rivaroxaban, also called Xarelto. There are other types of oral anticoagulants that are on the market as well. These drugs are the two that are most commonly used due to the research that's been done. So these pills are typically taken once a day, and a few nuances about these drugs. The first is that unlike the injections, they may interact with your chemotherapy or with other medications or supplements, and this is a very important point. If there are drug-drug interactions with your chemotherapy, for example, this may cause the levels of these blood thinners to go up or down, and so we need to make sure that a careful look at your medications is occurring with your pharmacist or with your oncologist. It may interact with other medications that are not chemotherapy. So for example, medications that we use for HIV or certain antibiotics or medications to treat seizures may sometimes interact with these drugs as well. And so you need to speak with your pharmacist about this. And also supplements. So supplements that are commonly used, like St. John's wort and CBD oil, for example, may interact with these medications as well. I won't go through an exhaustive list, but you should definitely let your doctors know about what you're taking, just so we can make sure that everything has been checked appropriately. The other thing to note about these drugs is that while they are similarly as effective as needles in most studies, they may lead to an increase in bleeding with certain types of cancer. So, you should speak to your doctor about whether these oral anticoagulants are the right option for you, and they will take these considerations into account. These drugs can't be used if the kidneys are greatly impaired, and that actually applies to the low molecular weight heparins as well. And again, the coverage for these drugs also varies by province. Finally, we have another pill called Warfarin. This is a blood thinning medication we've been using for 50, 60, maybe even 70 years. This is a drug that's taken once a day, and it's effective outside of cancer, but unfortunately, in comparison to the needles, they're not as effective. And part of the issue is that being on this drug requires very frequent monitoring to make sure the blood is not too thick and not too thin. And this is because there are many interactions with different medications and with your diet. So depending on the amount of vitamin K you're consuming in your diet, this may impact on the dosing of the warfarin. The advantage of warfarin is that it's widely available, and because it's been on the market for a long time, it's inexpensive. I mentioned this before, but because these medications do thin the blood, they also do increase the risk of bleeding. So the bleeding may happen in the head if you fall and hit your head, or if you have another issue inside the head. For example, if you have an aneurysm in your head. Or you should talk to your doctor about the safety of blood thinners if you have disease in your head as well. In terms of the urine, patients sometimes experience blood in the urine, especially if they have diseases like bladder cancer, for example. And finally, the most common site of bleeding with blood thinning medication is bleeding from the stomach or from the intestines. And so this would be manifested with bleeding in the poop, or also black stools as well. And this is in particular the case if the tumor is present in the GI tract, either in the stomach, the esophagus, or in the colon, for example. So in summary, this is a lot of information, but I would encourage you to ask your doctor about which blood thinner is the most appropriate for you. There are many considerations to take into account, and certainly being on a needle once a day is a challenging thing to take on amongst everything else that's happening. And so a discussion about whether pills are a reasonable option for you is certainly worth considering as well. Also, we've mentioned the side effects and the bleeding associated with blood thinning medication, but in general, the clotting risk usually outweighs the bleeding risk, especially at the beginning, because as we mentioned before, there are situations when a blood clot can actually be fatal, and so it's important to treat these aggressively if possible. So what can you do now? That might be the question that you're asking. And whether you've had a blood clot or not, there are some things that you can think about, especially as we think about the contents from this webinar today. The first is prevention. So you should let your doctor know if you have had a blood clot before, because that might increase your risk of having a subsequent blood clot, especially as you go through treatment for cancer. Also, there's new evidence over the past year to suggest that preventative blood thinners might be helpful to prevent a blood clot before the blood clot actually happens. And depending on where your care is happening, there may or may not be a role for this. And so this is something you can speak with your doctors about as well. There are benefits and benefits and risks to providing preventative blood thinners, and this is not the best approach for everyone. And I think the most important thing from today would be awareness. Not to ignore your symptoms, and also ask lots of questions. And I'll provide my contact information at the end of this webinar as well if you have further questions as well. How long do we treat with blood thinning medication for? So anticoagulation therapy, or blood thinning medications for venous thrombosis and cancer, are typically at least 3 to 6 months, usually at least 6 months in my practice. So I'll take you through kind of the scenario. Let's say you've been diagnosed with cancer and then you're receiving chemotherapy and surgery. As we mentioned, most blood clots happen early on, within the first few months of the cancer diagnosis. You've completed 3 to 6 months of blood thinning medication for the blood clot. This is the point at which we would typically reassess how long to treat with blood thinning medication for. And the decision about duration of blood thinning medication really depends on what's happening with the cancer. Is the treatment for cancer complete? Is there still disease present? Are you having any side effects from the blood thinning medication, including bleeding? Is the catheter still in place? These may be reasons why it may be appropriate to extend your blood thinning medication beyond 6 months. Particularly with adjuvant therapy after surgery, this may be a reason to extend blood thinning medication as well. Because again, as long as the risk factor for blood clotting, cancer, or treatment are present, the risk of thrombosis is often still present as well. But again, this is a discussion with your doctors. So let's go back to our goals, and then we'll conclude, and then I'll be happy to take your questions. We talked about what is a blood clot, when should I worry, what should I do if I'm worried, and how are blood clots treated. So what is a blood clot? We talked about a blockage of the veins in the legs or the lungs, and occasionally in the arm. When should you worry? In the legs, swelling or redness. In the chest, shortness of breath, pain, or chest pressure. What should you do if you're worried? Go to the ER, speak to your doctor, or call 911. And finally, how are blood clots treated? We talked about different options for blood thinning medication, which would include pills or needles. I would encourage you to go to the Thrombosis Canada website. So Thrombosis Canada is the Canadian organization for thrombosis awareness. And healthcare providers and patients often go to this website as their first resource for information about thrombosis. And they've developed a mnemonic, easy to remember, clots. So the C is for chest pain, the L is for lightheadedness, the O is for out of breath, T is for tenderness of the leg, and then S is for swelling of the leg. If these are symptoms that you see present, then please do seek medical attention. Finally, a few additional resources. If you'd like to have this information again in a much more condensed way, this webinar will be available online through CCSN, but also on Thrombosis Canada, there's a wonderful whiteboard video about VTE and cancer that's only 5 minutes long, so you don't have to listen to me for half an hour talking about this topic. And then also pamphlets, videos, and drug information also available on the Thrombosis Canada website. And then World Thrombosis Day, as we had discussed. Finally, I will also talk about the Canadian Cancer Survivor Network. As you know, they have lots of important and helpful webinars that are available, and this is all of their contact information. And I do thank you very much for your participation. I hope I haven't put you to sleep, but if you have, that's okay. And I'm happy to take your questions, and this is my contact information on the screen. Thank you.
Great, thank you, Dr. Tseng. We do have a few questions, quite a few actually. I'll pick and choose some of the ones that I think are more general, and then maybe I'll pass along some of the more specific ones to you after that. So we'll start with, are there cancers that are more predisposed to causing blood clots?
So thank you for that question. The question was, are there certain tumor types that are more prone to blood clots? There are. The ones that, so I will say at the outset that, as I mentioned before, regardless of the type of cancer, if there is metastatic spread or distant spread, that does increase the risk of clotting. But also there are certain tumor types, including pancreatic cancer, gastric cancer, lung cancer, and some of the hematologic malignancies like lymphoma, myeloma, and also some brain cancers, glioblastoma multiforme in particular, that have an increased risk of blood clotting as well.
Thank you. Another question, does having lymphedema increase the risk of blood clots?
So the question is, if there's swelling in an arm or a leg from lymphedema, does that increase the risk of a blood clot? I think the answer to that question depends on why the lymphedema is happening. So for example, if the lymphedema is happening as a result of previous surgery, for example, a lymph node dissection for breast cancer, that in and of itself should not increase the risk of thrombosis because there's no blockage of the vein per se. However, if there is a tumor in the pelvis, for example, that is also causing compression of the lymph node of the lymph drainage, there is some possibility that that tumor in that area could also be compressing on a vein. And sometimes, in that scenario, you could see a blood clot happening due to, in other words, a blockage of the highway, and that might be a way in which thrombosis happens. So it really would come back to depending on what's happening with the lymphedema and why is it happening.
What is the role of the daily dose of low aspirin, especially with ongoing treatment?
So the question was, if I'm receiving ongoing treatment for cancer, is there a role for using aspirin on a preventative basis? And I will start to say by saying that aspirin is used for a lot of different reasons outside of cancer and outside of clotting, and the most common reason that it's used is probably for coronary artery disease. Aspirin, for the purposes of preventing vein clots in cancer, has not been studied very much. In most cases, our experience has been that it is not as effective for preventing blood clots as blood thinning medication. And again, to my knowledge, I don't know of a large study looking at aspirin for prevention. However, there are some studies in people who have multiple myeloma, for example, where aspirin was used. Most of the studies looking at preventative blood thinners have used either needles or the direct oral anticoagulants for prevention of blood clots. So is aspirin effective for preventing clots in cancer? I would say that it would not be the first choice that I would use. However, I suspect it probably is somewhat helpful if you're on it for another reason.
Great, thank you. Another question. Are cancer patients routinely advised of the potential for developing blood clots?
Thank you for that question. The question is, as cancer patients are in their clinic or going through chemotherapy, are they provided with information in terms of awareness for blood clots? I would say the answer is, in my experience, has been not enough. I think it's a big issue, and I think that's why campaigns like the Clots campaign from Thrombosis Canada are so important. I think there's so many things happening in cancer care and so many things to keep track of that sometimes we forget to talk about blood clotting, and I think it's a really important issue. The reason why some blood clots are often picked up incidentally on CT scans is often because people don't notice the symptoms or they attribute it to other things. And so I think the more information you have and the more you can tell other people who you know about these symptoms, I think it's really important to keep aware of these signs and symptoms. If you're a healthcare provider listening to this as well, this is why we have World Thrombosis Day. There needs to be increasing awareness about this issue. Thank you.
Great. Maybe one last question before we wrap it up. Does CBD and/or THC oil interfere with fragment?
Thank you for that question. The question is, does the use of THC or CBD oil interfere with low molecular weight heparins or fragments? To my knowledge, they do not. CBD oil, we have very limited data. It does suggest that it may interact with some of the enzymes in the liver that may affect the metabolism of the pills, the direct oral anticoagulants, but with fragment, with the needles, there's no known drug interaction that I know of.
Great. I think we'll wrap up the question and answer session there. I will pass along some of the more specific questions that I've received to yourself, Dr. Tseng. And if anyone else has any questions, you can pass them along to Dr. Tseng using the information on the screen, or you can pass them along to myself at communications@survivornet.ca. And that brings us to the end of today's session.